Welcome to Connections, the podcast from addiction professionals of North Carolina, where we explore the nuances of addiction and mental health through the lens of policy and practice.
We're your hosts, Morgan Coyner
and Sarah Howe,
and we're here to help you see how it all connects.
Today, we are excited to have with us our good friend and colleague, Kym Laube, who is the Executive Director of HUGS in New York. Welcome to the podcast, Kym.
Well, thanks for having me. And what a fantastic name and way to bring us all together.
We are so excited to have you. For those of our listeners who haven't yet had the opportunity to meet Kym, she has spoken in North Carolina several times and comes back by popular demand to help us connect prevention to recovery. So this is a perfect place for us to start. Kym, you have worked on both ends of the spectrum, in the prevention field and with our recovery communities. So tell us a little bit more how those two things, which often people think do not connect, really are closely connected. Help us see how that happens.
Fantastic. So first of all, I love prevention. And I've been in the business for prevention for many years. But I'm also a person in recovery. And so I absolutely understand the very way upstream way we need to look at things in order to create good community change. And I also understand what happens when you're one of those people who falls into the river and wasn't protected upstream. And it's important that we realize that we are actually more connected. As a matter of fact, Sarah Potter, who is well known to so many people at APNC, Sarah Potter is quoted in one of my webinars as saying that prevention and recovery are the most natural allies. And we are. Because when prevention, it's a great quote, right? And oftentimes when we think of prevention, we just think of schools. Those are the programs that happen in schools. But prevention is about community change. It's about environmental change. It's working when preventionists work to reduce the hours of sale of alcohol or substances, when they get good placement where it's not just sitting right on the counter so you can grab and go. When they work on great store policies, that's not only protecting our young people, that's protecting our friend who goes in after a fellowship meeting and goes to the store and maybe is feeling a little bit down. They don't have product placement right in front of them. So when we create healthier communities as preventionists, it actually supports and enhances the lifestyle and shows less exposure to not only our youth, but our recovery community as well.
That's fantastic. I love that because I don't think we often see that's one continuum. We see them as very individual. We have prevention over here, we have recovery here, and then we maybe have a treatment episode in the middle, right? Sometimes we think of those in those very clear silos, and yet we're one individual that comes in and out of different places in our life.
And it's so important that we spend more time talking together. Oftentimes, our conferences will be a prevention conference, a treatment conference, a harm reduction conference, a recovery conference. And if we have them all in the same place, we put them into different tracks. And if we only look at things from our lens, our vantage point, that's what we're going to see. And so it really becomes important and paramount of leaders like yourself, and exactly what you guys do is have conferences that brings everybody to the table with meaningful opportunities to talk and engage and understand. Prevention is so strong on teaching emotional intelligence. And we know emotional intelligence is a key factor, not only to how to live life, but also a key factor in recovery, and such an important piece for us to learn, as many of us use substances to not deal with our feelings. So again, the partnership it's prime for this opportunity for us to really talk about what we can do more together as looking at this as different ends of the spectrum.
Sarah and I were talking earlier, and, there's a lot of conversations around recovery-ready communities and how do we create communities that can support people in recovery. And we were talking about, we need people doing harm reduction. We need people who keep people who are currently using drugs alive. We need treatment because when people are ready to get, healthy, when they're ready to kind of address the issues that they're facing, we need those people, right? We need recovery-ready communities who can support them. But if we don't have prevention, this crisis continues, because all we do is raise up another generation of kids who don't know how to cope, who don't know what to do when hard things happen. And so prevention, to me, can be this linchpin that could potentially turn the tide in what has been a very difficult 20 years for this field.
Right. And we have science. I mean, that's the piece. Like when we talk about prevention, we have the strategic prevention framework. We have this way that we can bring together the butcher, the baker, the candlestick maker, and join forces to really not just say, hey, the kids are drinking and drugging and that's bad, but really to turn around and take a look at, but why? And why specifically here in our community? And that starts by bringing everybody together, by building capacity, by doing a hardcore assessment of your community, taking a look at qualitative and quantitative data to begin to put those pieces to the puzzle together, and then to begin to plan strategies. And here's the challenge. We can't just plan 6-month strategies. We can't just say, oh, let's try this and see if this works. We actually have to be strategic and understand that community change takes 5 to 10 years to begin to happen. And so by planning, by implementing, by evaluating, we can begin to use that strategic prevention framework. And communities that have done it and do utilize that show a 30-day reduction of substances. They show a delay of onset of when a young person starts picking up a substance. And those are two key indicators, right? What's our behavior been for the last 30 days? At what age did we begin to pick up? What were the community norms, and what were low perceptions of risk? These are all things we talk about that have to be in the conversation, because it's not like somebody just picked up a drink and boom, they had a disease. This is really about how did we get there, and why specifically in each of our communities has addiction, substance use disorder been allowed to almost grow and flourish based on community norming, based on access to substances, both retail and in the home, and based on low perceived risk.
Mm-hmm. Well, I'm so glad that you brought up science. And Kym, you and I have had this conversation a lot, that there's a myth out there that there isn't science that backs prevention. And unfortunately, we know some of the prevention in the past probably helped proliferate that. There's programs out there that shall remain nameless that had didn't have a good rap, right?
Right,
but
for sure.
For our listeners, what we're trying to do here is not only make these connections for our field, but for our listeners who don't do this every day, who don't talk this language. Why is prevention so important from the science perspective? I mean, you just brought up the data, which I think is really critical, but really that it works, and we know that it works. How can we help the average person, like you said, the baker that doesn't do this every day, understand, okay, it's not just those programs of old that were just saying no, that it just didn't work. So let's talk a little bit about more why we know this works.
Right. It starts with messaging and normalizing, right? So many times in our daily life, whether it's our emojis that we send or the gifts that we give, oftentimes, even people, to me, I share a story once of how I went out onto social media and I put the post, that it was my recovery anniversary, and people were like congratulating me, and we did it in order to break stigma. And then so many people were like, wow, how awesome is this? And naturally just sent the champagne bottle and the emoji of the champagne bottle and the glasses. It's become so ingrained in our culture, and even from our social media and our Bitmoji, that we don't even begin to question anymore. And so that subliminal messaging that's out there is just very huge and weighs heavy and normalizes the amount. Again, I'll always go back to advertising, and it's so important for everyday friends, those of us who don't touch the field, to realize that there are simple things they can do to begin to help and support. Like, one, they're going to tell their kids, if they have kids, they can have fun without the use of alcohol. And so we need to show kids how to do that. Have a backyard party one time a year. Get your friends together and say, look, here's the deal. We're not going to have alcohol. We're going to show our kids that we can have a good time without substances. Just as a great way of example. If they do have substances at their, if they do have alcohol at their parties, separate the coolers. Make sure that they're clearly marked. Make sure that there's a system where you know. The piece that is so important is those young developing brains, that time when that brain is in adolescence, when it's going to grow the most and is going through that neuropruning process. It's so important that we keep all substances out of there. And the average brain, the average adolescent brain doesn't hardwire until an average age of 25. And oftentimes we think like, we hear the word 25 and we're like, okay, brain's good now. And the truth is it's an average age of 25. And you have to kind of know your kid to know which side of the average they are on, right? So it does become for the everyday person to understand that prevention, the same as we teach to put seatbelts on, we teach to put sunblock on, we teach to look both ways, to wear a hat. There's so many other harm reducing strategies we use to teach our children. This is one layer of it. And as we can begin to incorporate health policy into family with a key focus on including substance misuse, including underage drinking in that conversation, that really takes us further down the road of being able to, one, reduce access, reduce early onset, and really change culture within our families and within our communities.
I think prevention has been one of the more challenging areas to explain to people because you can't prove what you don't see.
Right.
Right. So you can't say, in theory, you can't say, right, because of this, I didn't pick up that drink. I didn't use substances. But there is science that actually tells us exactly what we were just saying about the brain development. The longer we can keep that youth from picking up that first drink, the less likely they are to develop a substance use disorder. We know that. And I think it's important that that messaging really gets out there. Because, yes, you can really clearly look at, I've been to treatment, and this is how long I've been on my recovery journey. This is how many years with my recovery anniversary. There's those milestones. But me, as somebody, a youth that grew up in prevention, I don't say, this is my Teen Institute anniversary. Right? We don't say that. But yet, I know that all those intersections helped keep me to a point of healthiness. And so integrating that language, I think, and how we help, like you were saying, the community norm to shifting that community norm that prevention language is not only okay, it's common. It's how we work in this community.
And we are seeing some sign of this becoming, since COVID, in fact, if you start to pay attention to your menus at restaurants, there are more non-alcoholic choices on our menus than we've ever had before. It increases your bill, right? Because if you should just get water, now you got to pay $8 for a fancy drink that has no alcohol in it, right? So but we're starting to see little changes like that. You saw people take on a 30-day challenge to challenge themselves to not drink during certain months of the year. And then what we have seen is people who've done that 30-day challenge and have not used substances, not because they had an addiction, just because they wanted to just try and see if they can do it. They actually chose another month and another month because they realized their body started to feel incredible without any substances in it. So it's really important to realize, again, we often look at this as the way downstream conversation, but this is just a conversation about health. And this is about how do we become our optimal self? And oftentimes, if you aren't somebody who has an addiction and you do choose alcohol, that's a choice. And also understand that it definitely has some health effects on our body. And the last thing I want to just kind of say to your point, Sarah, about when we're talking about numbers, when they took a look at all the individuals who had been diagnosed, who had a diagnosis, right, where they wound up in treatment, 90% of them reported using substances in their teen years. 90%. So if we said 90% of all diabetics ate sugar when they were in their teens, we would make sure that no teens ever got sugar.
Yep, sure would.
We have to make sure that we use that bit of science to understand the impact of that young developing brain early on.
And I think that's why so much of this happens, like you said, at the community and even the family level, because like families have their own norms around these things, right? There are some families who'd be like, yeah, great, no sugar. That's not going to be a hard change for us. And there are some families that are like, my kids might die because they won't eat anything now. Like, you know, we have those differences. And, you know, we've got families who don't drink alcohol, and you have families who are like, you can do whatever you want as long as it's in my house. You know, like all of that, like it's a big task to put forth. And that's why folks like you have been doing this work, like you said, for years to get there.
Yep. I would say
We need to be.
Oh, no. Go ahead before I ask you the question.
We just really need to be so much more comprehensive about prevention and really double down on it. Double down on it with funding, double down on it in recognizing its seriousness in this conversation, that this isn't just about schools, this is about community. And it's really about making conscious change in the 4 different domains, making conscious change with schools, with communities, with families, and of course, amongst young individuals as well. And it has to be concentrated around all 4 areas.
I mean, you kind of actually just answered my question. So well done, first of all, because I was going to ask you, you know, what's the key takeaway, right? If there was one thing that someone could take away from today, and I think you really did, you hit on it. We've got to double down on prevention, and we really need to focus more on it than less. It's an area, I think Morgan said it really, really succinctly earlier, that how can we raise the next generation of substance-free kids? That's the way to resolve some of these other large crises that we know we are addressing post-pandemic. This is the actual answer. So,
and it really becomes so important to question why, to begin to build in good strategies to address the why, and to stop normalizing kids drinking or minimize kids drinking, right? Yeah. Oftentimes we're like, oh, they're just drinking, they're not doing the heavy stuff. But follow the science, follow the people who wound up in, you know, into some of those heavy, oftentimes it starts with alcohol. We cannot play one drug against another. Alcohol still took out 180,000 last year, right? But we get alarmed by fentanyl because it's quick and it hits people at a younger age. It's not as long term. We can't begin to like favor one over the other. We just really need to protect those young developing brains and create health policy all around.
Yep. Kym, I hope you'll come back.
Of course.
Because we just scratched the surface on prevention, and we're going to be bringing a lot of different prevention experts from North Carolina and across the country, but we are so grateful that you took the time to join us today and just get a little bit of a teaser, really, on this conversation that we need to keep going.
Absolutely. And thanks for highlighting prevention. Oftentimes, we find even across the country, we don't want to talk about the upstream stuff because it's a little bit more vague. So thank you for being willing to highlight this and give us a space and give us a voice.
Absolutely.